Riley Paul Hansen was diagnosed with hypoplastic left heart syndrome at her 20-week ultrasound, and we knew that we needed to come to Children's to have the surgeries done. And Riley had the first surgery and the second surgery, but was unable to have the third surgery because of his heart not being able to squeeze as well and his low cardiac output. And he was slowly deteriorating, and they were telling my husband and I that we needed to do a conference on what the next best thing for Riley was. I needed something. I needed to get out my anger. And I immediately found Marianne, and I grabbed her and said, I need to do something. I said, I need to get out my frustrations and this negativity.
They had had a bad day, and they had received some bad news. And they didn't quite know how to handle it or how to work through it. There were no words to describe what they were going through.
So she said, let's go throw some paint. And I said, I don't think that's gonna help. And she said, yes, it was. And we went in the back, and I started yelling and threw a bunch of paint at a picture, and I felt so much better.
The family was torn apart because one member of the family's in the hospital, the others are here, Dad has to go back home to work, and so the family was really quite disjointed, and it showed in their artwork, in little segments. And so when I pointed that out to them, they then, as a family, grabbed paint and they started squeezing paint. And the mom, just had this great cathartic moment, and she said, I need to do this. And she just scribbled all over the surface of the painting, large brush strokes, and she just got it out. And at the end, the whole family just sat there, and all Mom said was, I needed that. Children's Hospital Art Therapy is brought to families in a variety of ways. The art therapy program, we work very closely with the child life specialists to discern which patients would benefit the most from art therapy. We also work as a team with the behavioral health and with the doctors and nurses, again, to discern which patients might benefit the most from art therapy.
Probably the most exciting thing is watching kids after one of the child life workers has been in with them and has brought out some of their intrinsic excitement about life and their or they do drawings, or you come back in and talk to them and say, so-and-so was here and now we're doing thus and such.
So I'm Pollyanna Kabara, and I'm a physician assistant in the emergency department, and I work very closely with the child life specialists. We use them on a daily basis in the emergency department to help distract the kids, especially with all the procedures that we do. We do a lot of IV starts and caths, spinal taps, splinting and suturing as well, and a lot of other procedures, and it really helps the patients and the families to reduce their anxiety and just to explain the procedures. It helps me a lot too, because I'm able then to do the best job possible and really focus on my procedure at hand when the child life specialist is able to help distract the patient. And before I do the procedure, the child life specialist will actually meet with the family and the patient and determine the best possible way to teach the child about the procedure. For example, if we're going to suture someone, they'll show the children and the family the tools that I'm going to use. They'll actually put a suture into a doll that the child can take home with them. And it just puts the children at ease to actually see and touch the things that we'll be using. And then after I'm done with the procedure, the child life specialist will give the child some stickers or a toy to take home. And during the procedure, they help to distract the child so I can just focus on the task at hand. Child life specialists are not just people who play with toys, as so many people think. They help with all the age-appropriate behaviors and education for the children and families. When we lose children in the emergency department, they actually help with bereavement. They come and they make handprints for the family to take home of the child. They have locks of hair for the family. They do so many things that people just don't even know that Child Life does. And all of it helps to provide the best care possible for the patients and the families and for us as staff as well. They really do make my job easier, and I just cannot thank them enough for all the hard work they put in.
iPads now are the new hip thing, and they're actually so multimedia friendly. So we've asked a donor who graciously gave us the funds to buy iPads for all the child life specialists here at the hospital. And we can now use them with kids like Madison so that they can play games even when they're having procedures or treatments done. We can use this when Madison has her breathing treatment, so she's not thinking about her breathing treatments and she's playing fun with a game. We can also use them for teaching and hopefully
This is an application we can use to help kids learn about an operating room or the IR, interventional radiology, or what a treatment room looks like in the ER. So if we click right here, this is interventional radiology. You can see what the machines look like in the room. And then let's say a kid's going to be having a PICC line and we want to show them what that's going to look like. We click on PICC line and it pulls up a picture of a PICC line. And then we can go back. And then we also have what ChloraPrep is, and then putting ChloraPrep on. So that's basically them cleaning the arm and getting ready to put the PICC line in.
We're able to download our prep books on there, and hopefully soon we'll even be able to make our own apps showing different parts of the hospital. It's just another form of media that we can use to help educate our families.
When it's all said and done and these kids get to go home after being here for days, weeks, months, it's not the medications that I administered that they'll remember. It's not the vital signs that I took multiple times. It's really the experience as a whole. And those fun little games we played to give them their medicines, or the goofy songs that we sing to get them through a hard procedure. Those are the things they come back and tell us that were the most memorable, that they still go home and sing when they have to take medicines at home. So it's those little pieces that they take with them that really mean the most to them. That means a lot to me. That's something cool. That's something we share, and it's our little bond. So,
Child Life has been amazing. They've helped my older son Connor, who is 4, to deal with his emotions going through this whole thing, not having his mom, there all the time. Marianne made a beautiful book to have Connor bring to school to explain to everybody why his family is so special and why his brother is in the hospital. So that was great. It made Connor feel special and helped him with his emotions as well.
To make you feel better.
Leslie has been there for everything. She's been there to give toys to Riley. She's been there to help with Connor when he's been having bad days when he's here at the hospital. She's just been amazing.
The total health of the child depends on more than medicines and therapies for illnesses and chronic illnesses. I think the total health of the child depends on the child having a voice and an outlet to talk about what excites them and what worries them. And I think that it's just part of the total package. It makes the child a child rather than simply a patient.
When families come back and the situation is so large that there's no way to describe what's going on, there's no way to say, I am so terrified that I might lose my child. When words fail us, art speaks.